Welcome back. The symptoms of ovarian cancer can be very hard to spot. The disease, often called a silent killer. In one article in Newsweek, a woman got an ovarian cancer diagnosis because she had a growth removed from her navel by her dermatologist, who thought it was all harmless. But a blood test revealed she had advanced stage ovarian cancer. Right now we have Dr. Sonali Jain joining us, and she is an OB-GYN with SSM Health Medical Group in Sunset Hills. Good morning to you, Dr. Jain.
Morning. Thank you for having me.
So a silent killer. Tell us why it's a little bit more difficult for people to get diagnosed for ovarian cancer.
So that is right. Ovarian cancer is always called a silent killer. A lot of times women present at an advanced stage of the disease. There is no screening test for ovarian cancer like for cervical cancer or breast cancer. So a lot of these women present at an advanced stage, and then it can be hard to treat them, and we lose a lot of women because of that, and that's why it's called the silent killer.
Okay.
It can also be called the whispering disease. And a lot of times women ask, well, what am I looking for?
Right. What are the symptoms, Dr. Jain?
That is right. So it's called the whispering disease because women, there are some symptoms, but we sometimes don't pay attention to it. The four most common symptoms could be just belly pain, abdominal pain, lower belly pain or pelvic pain, bloating or your abdomen getting bigger, distending, just kind of having pressure with passing urine or just going to the bathroom too often, feeling too full, just feeling like you cannot eat a lot at one time. And a lot of times women will just think that, oh, this is just because I have a GI upset or I'm just getting older.
Right.
And it is a disease of older women, seen more in 60s or 70s. So a lot of time women will not pay attention to these symptoms, but the symptoms are there.
So, Dr. Jain, the symptoms could be easily mistaken for something
right.
else. So tell us if there's a test that people can get. You said there's no way to screen for it. Is there a test that people can go?
The first thing to do is just be aware of your symptoms and seek care.
Okay.
Seeing your gynecologist every year is very important so that these symptoms can be asked. And then a pelvic exam by a gynecologist to see if your ovaries are enlarged. There are some tests that we can do, like an ultrasound or a blood test called CA-125, if there is a suspicion for ovarian cancer.
Is there anything that us as women can do to lower our risks for ovarian cancer?
Yes, absolutely. Birth control pills decrease the risk of ovarian cancer.
Okay.
So taking birth control pills for 5 years or longer can decrease your risk. It is also seen in women that have a history of other cancers sometimes. So getting genetic testing done, and then if genetic testing is positive, some women are offered removal of ovaries. And if ovaries are removed, then you're decreasing the risk of cancer.
Okay, thank you, Dr. Jain, so much for joining us with that very, very important information. If you guys would like to learn more, we have more information for you on our website, fox2now.com. We'll be right back after this.